So in
Yes,
our
sir.
country, the people continue to suffer due to ignorance and inertia. So ignorance in their part is very much expected because they believe the doctor like Narayano Vaidyo Hari. They consider doctor as Narayana. Narayana means the God, and they submit their everything to the God, and God has become corrupt because he is interested in the selling the more medicines, prescribing the more medicines under the pressure of the pharmaceutical industry. He is selling more and more medicines, and the people are taking more and more medicines, which will not give health. Definitely, more medicines means more illness, not more health. Please understand this. Madam, change the slide to the thing. That will I will come to you later. Payment of professional fees. Okay, I'll complete this, then we can change the slide. So what has happened in this country is the payment, the government of India permits the registered pharmacists to charge money for the services provided. But again, here also they are not clear about it. As a result of it, the registered pharmacist, all your teachers who are registered pharmacists can do services, can do pharmacy practice, like doctor practices in the evening, like nurses practices in their free time. So pharmacist also can practice and earn more money. So the practice of pharmacy doesn't mean that you have to have a medical shop. Many people consider that we should have our own medical shop. Not necessary. You can have the medical shop and you can do counseling. That's a different part. If you don't have a medical shop, if you are a registered pharmacist, in your free time you have to give. In your free time you have to give. You have to check the prescription whether it is appropriate, whether the doses are mentioned properly, whether the patient has understood the things what is written in the prescription. All these things trusting has to be done by the registered pharmacist. And after that only the medicines are handed over to the patient. So this is how the things goes on. So as a result of the ignorance and the inner, see, we teachers will suffer from a very big disease called as inertia. Inertia is not able to move out of the convenience zone. We are very much a comfort zone. We want to live in our own comfort zone. Don't want to go and help the people without knowledge. So you have learned a lot of knowledge. You have learned a lot of pharmacy knowledge, but it is utilized only for teaching.
Please
It
mute
is not
your
used
mobile.
for practice. Who has said that you should not practice your knowledge? Well, doctors can do it, well, nurse can do it, why pharmacist can't do it? Is my question. So this is how the things we should change our way of approach. We must start practicing because it is legal. As per the pharmacy practice regulation 2015, we are eligible to do pharmacy practice. Whether we can have a license for running a medical shop, that's a different aspect. Don't mistake. License is required for pharmacy practice. License is not required. License is required for opening a medical shop, not for this. So the duties of the registered pharmacists include to the public and to the profession. So here we will talk about the to the patient. As I explained you, we do everything for the patient's sake. We make medicines and we sell medicines and we see that the patient should be in a good condition. It is only possible when all of us will take care that the patient is not ill informed, he is not been having any patient issues, patient safety issues by wrong use of medicines, or wrong way of using the medicines, wrong storage of medicines. So please, friends, you have to take care of that. As a registered pharmacist, it becomes responsibility. How many patients you know in the world? My question to you straight: how many patients you know in the world? Swati, madam, you are playing my slides randomly. It is not going to help. It's going to confuse more. Come to the slide number 3. Code
Slide
of
number
ethics.
3.
Code
Okay, sir.
Code of ethics. Next slide. Next slide. Yeah, this one. So here I would like to discuss some important issues, and also I want to convince you with my own example that the community pharmacists uh, are like pillars of healthcare system in developed countries, in USA and in Canada, where I have visited as a part of my professional engagements. I also developed a habit of visiting medical shops. Many of my students, after completing their B Farm, those days the Form D was not there, they went there and they appeared for an examination, and they cleared the examination, and afterwards they became registered pharmacists. This examination has to be appeared again and again because the knowledge of the pharmacy is never stagnant. It grows on, it grows and it changes every 3 years once or every 2 years once. Knowledge will be changing. As a result of it, the pharmacist has to keep update. Whether the pharmacist is updating or not, they will cancel the license after 2 years of practice, and they will ask the pharmacist to apply for the fresh license of practice, not a medical shop practice. So while he's practicing it, to remain in continuity in practice, he will study more about the new drugs, and he will be aware of the knowledge of the latest drugs and latest knowledge. Here, no such system. Once you are registered pharmacist, even after your death also, your registration continues. There is nobody to bother that you are not alive, and your certificate is not been valid. Not like that. And we are also changing, and we should also change here also, because we should do as per the convenience, as per the interest of the patients. So, dharma rakshati rakshita means if you protect dharma, if you are a good person, that the goodness will come to your rescue. This has happened with my own father. He was a pharmacist by training. So you may wonder what is the pharmacist by training. In 1954, when he was just a 27-year-old, 28-year-old person, the advertisement appeared in the newspapers that Karnataka's Drugs Control Department is calling for applications for license, and the main condition is they should come to the Bangalore and stay there for 3 weeks, and they will train them. After successful completion of the training, they can be an independent pharmacist. They can practice their profession. So, like that, they told, and many people uh, joined and left. And now the the code of ethics says that my own story begins like this. I was telling that my father was a pharmacist by training of 3 weeks, exactly 21 days. So the advertisement said that 21 days you have to come and stay in Bangalore, and they will conduct some lectures and you will attend. There is no examination, and you will be given license. So like that, throughout Karnataka, people came in 1954 and became registered pharmacists. So then what happened after that? There was a when this man came to Harihar to open his medical shop, he opened a medical shop and his license was there, but knowledge was not there, nothing he was knowing. And how to update his knowledge. So he made he was a very cleverest person, and the pharmaceutical industry used to send the medical representatives. These medical representatives used to detail their product to the doctor and explain them what is the product, how to use it, how to store it, and all these things. And they also visit the medical shop where they wanted to see that the stocks of the medicines are kept there, and after prescription they can see that the drugs are sold. This is a model which is very followed throughout India, and even in Himachal Pradesh, same model would be there. So when the medical representatives came to take orders to keep the stock of their detailed product, my father asked them one question. Can you explain me what we explain to doctors? Like that, every representative went on listening, and by the end of 3 years, he was an expert, knowledgeable person as far as the medicines are there. So that's how he became very popular, and then he went on doing service to the people, and people recognized his services. And then one special quality he had, the in those times there used to be a there used to be an injection called as anti-snake venom, which is costing 500 rupees, and which is a life-saving drug in case of a snake bite. And Hopkins Institute, Pune used to make it. So its expiry date is very short in those times, 6 months. So they used to buy it, and then if it is not utilized, the whole economic loss will fall on the pharmacist or the registered pharmacist medical shop. So nobody was keeping stock of that. My father dared to keep that while always, and many people were knowing about this quality, and many people came to purchase that medical shop at the mid of time, and then my father will go there to medical shop and happily dispense that anti-snake venom, and also he can the like that he used to do services, and people recognized him, and he became more and more prosperous in due course of time, and he wanted to diversify, and he diversified successfully also. He entered into the many other sectors which are not related, fertilizers and all those things. He this thing. The Further, what happened? Due to his diversification, he lost interest, and people, his own friends or foes, whatever you call them, like in Hindi cinema, they ditched him, and he became pauper. And when he became pauper, he came to medical shop again and stood there. And there was a thing in medical shop also was also empty, because the in charge person has taken everything and left the bills to be settled. So like that, he was in great problem. The people in the Harrier saw this plight of this man, and they took pity on him, and they said that let us help this person, how we can help. So whenever they used to get a prescription, they used to come to the newer medical shops and find out whether that such medicine is available there. If available, then they will immediately purchase. If it is not available, then they will go to other shop. Like this, everybody did like this. Within 2-3 years, my father's economic condition was revived, and he became financially sound like before. So, what is the moral of the story is the community which we consider as inert and does not respond. Why should we do it? To all these people, I have got this answer. The community is very active and observing every movement of you, taking note of it. If you are good, they will come to you. If you are bad, they will try to avoid you. So this is how the community works out. Please be kind to the people. In our way of services, we used to visit various homes. Our model of service is, so I was teaching. I have to after my evening hours in Manipal, I requested Premchand, owner of the Manipal Drug House, an ex-alumni of the MCAS. He happily provided the space in front of it. There we kept our table, and we monitored the blood pressure, we monitored the blood sugars, we monitored the PMI under the aegis of Association of Community Pharmacists of India. So like this, we wanted to make an impact in the public mind. And also on Sundays, half day, we used to take off, the morning off. We used to visit homes, and then we used to find out the home medication review. We wanted to see whether our intervention is going to help the people or not. So then what happened? The things like that. There were in our course of visits, we visited a home wherein a 75-year-old man and 70-year-old lady was alone living in the home, and lady was bedridden. She was bedridden, and then we asked the gentleman why she is bedridden, what has happened to her. Oh, no, sir, she complains weakness always. We have been giving so much of medicines to her. Our both systems are settled in abroad. There is no dearth of money. We have got enough money, but still, my wife and myself are not enjoying good quality of life. Then I asked them, so my mind, so the brain, my brain get activated immediately, and I found out that we can do something here. What we can do? We asked them what they eat every day. So for 1 week, what they ate, they told everything, but to our surprise, there was lack of protein. The protein was not there. They're also taking the vitamins, the minerals, what all the things they've been thinking that their health will come back to energy will come up. But the proteins are very, very important, and they are not there because in South India they always eat the rice in different forms. Dal they don't eat at all. So as a result of it, they have the deficiency of the protein. And what we suggested is we could have told them that you can take a protein supplement. It's very expensive. They can afford. That's not a problem. But we said that no. Let us look into a natural manner how the protein has to be made up in the body. So what we said, you take one fistful of green saboth moong. You know, understand? Green gram. Green gram. Do you understand what is it? Moong. So that one, they can soak it in water in the night time. In the morning, they can eat. So 2 fistfuls of moong every day. Both husband and wife ate for 15 days. And next visit when we went there, the lady was very much agile and she was very much active. She made tea for all the team members. We are around 7-8 members. She served 7-8 cups of tea to us as a expression of gratitude because we have solved our problems. The problem is not the money. Problem is not the doctor. See, you go and ask a medical shop, he will give painkillers. Weakness is there, give some iron tonic. They will not go deep into the problem. So when we could see that problem, we could address it. Even in our evening practices, there are several college-going girls because Manipal University is a educational hub. So a lot of courses of all on the earth are there. So the students used to come to medical shop, especially the female who are around 17, 18, 19-year-old. They used to come and ask for the medicine to get a relief for the backache. So this fellow would have was very happy in dispensing diclofenac sodium, limoncelide, but it is very risky. Although it will solve the problem, what will happen to in the long run? The drugs are very, 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 very dangerous. I would like to quote 2 examples, one of my own and one of my friend's mother. My example is when I completed my B.Pharm, as a familial disorder, I became a victim of schizophrenia and depression. So, in order to take away from depression, take out of depression, they gave the lithium salts, lithium carbonate, and it worked wonder. I came out of it. But again, after 50 years, means 35 years, when I was 33 to 35 years, my pancreas failed because the lithium which was given as per the rules, as per the condition, there should be a blood level monitoring, which was not done in my case. As a result of it, the lithium was given, and sometimes it exceeded the dose, and when it came to the it went on accumulating in my pancreas. It is cumulative poison, they call it as. So at 35 years, it destroyed all my pancreatic beta cells, and I was severe diabetic. So from 35 years to 65 years, 68 years, I am suffering because the negligence of the healthcare team who could prescribe lithium for my 10 siblings to our parents. Neither of my father and mother nor my brothers and sisters are diabetic at the age which I became diabetic. Now they might have developed a different issue. So this is how the things will go. And then one more example is gentamicin. Gentamicin is a antibiotic, brother of streptomycin, kanamycin, and all those things. And these antibiotics, these class of antibiotics, are known to cause ototoxicity, hearing impairment. Hearing impairment. They call hearing impairment. My friend's mother, Dr. Sekhar, who is a professor of pharmacy practice in USA, and who has got a brother in IIT Delhi, and his mother got cancer. So at that time, they took to a very prestigious hospital, and they gave radiation therapy, chemotherapy, what all that, and that lady survived. So in that course of treatment, she developed an infection. So for that, they have to give gentamicin. So gentamicin, when given, they also should monitor the blood level. Monitor, and as a result of it, the ear of the lady became damaged. And this lady also complained to the doctor in the ward. Doctor साहब मेरे को कम सुनाई पड़ रहा है. And then doctor, checked the prescriptions, and gentamicin was there, and it was not monitored. And as she is a mother of professors, two professors on IIT and one in USA, so the doctor coolly said that, माँ जी, आपका उम्र तो हो गया, आपका जिंदगी हो गया, इतने दिन आपने दिया, आपका कैंसर तो हमने ठीक कर दिया ना, आपका कैंसर तो हमने ठीक कर दिया, अब सुनाई पड़े ना सुनाई पड़े इससे क्या फर्क पड़ता है आपको, छोड़िए इस बात को, ऐसे बोल के चला गया. See, actually, the doctor went out, took it very simply, but that lady survived for 5 years, and all these 5 years, whoever want to talk to her should speak in very high speech, and also she was impaired due to negligence of non-monitoring of gentamicin levels, which could have been done. It is not done, and she suffered. Whole family's quality of life was disturbed. So this is why, like this, there are so many examples. Dr. Mahadev Bhatt will be enlightening you, and I think we can go to the next slide.
This one?
Yeah. This explains, the pharmacist's job is to see that the medicines, after dispensing or while dispensing, a pharmacist has to check whether the dose is proper, whether it is causing any side effect, whether it is causing any drowsiness. All these things he has to check and inform the patient. And in our country, only registered pharmacist is allowed to do it. It is the exclusive rights as per this law, exclusively about medicines, pharmacists can alone speak, not even doctors, not even the saying it is illegal if they speak. But what to do? There is no law system, so that's why the things go on continue. So there are so many other responsibilities which you will study in the course of the course of your study. But may I have the next slide, please? Yeah, duties and responsibilities. Next page. Already she has told. Yeah.
The next slide?
Yeah, next slide, madam. Yeah. So if anybody does any mistake, there is a punishment for the pharmacist even. Next slide, please. So this law also makes us to collect money for the services whatever the we are providing. Next slide, please. Yeah, this is a notification. Yeah, next slide, please. Come out of this law. Yeah. Yeah, here is an important small story I would like to share. A student from Kathmandu, in Nepal, she came to me and she wanted to do a project under me. I was working in Manipal University. She wanted to work with me. They have an tie-up, so they allowed her to do a project with me. In their project, she selected around 120 diabetic patients and she measured, she gave the pharmaceutical care as per her definition, and also she made two groups. One is all the same group before pharmaceutical care and after pharmaceutical care, and she used an instrument called the ADQUIL, Audit of Diabetic Quality Care of Diabetic Life. So she could find out that the pharmaceutical care has a better improved the conditions of the patients and saved the money for the patients, saved the money for the doctor, saved the money for the government. So that is the power of pharmaceutical care. Can I have the next slide, please? She opened up a clinic in Pune and run it for 2 years. 2 years, and she got a good amount of money, and she had a better offer. So she had to do one good thing. So in her practice, she used to consult doctors and tell doctor that I will monitor your patients. Can you please refer your patients to me? So doctor was happy because she never posed him as a competitor. She and doctor can tell to the patient that you discuss with the pharmacist. They will tell you everything. So like that, the cooperation or the cohabitation or the symbiosis, living together, happened in the first in the case of doctors and nurses and the pharmacists or the community pharmacists. Can I have the next slide, please? Yeah, next slide, please. Change the slide. Change the slide.
Yes, sir.
Change the slide. Yeah, stop here. Stop here and Swati madam, can you read this? And one more person can read after this.
This one, sir.
Yeah, the case. Previously the case is there. This is the solution for the case. No,
Yes.
no, you have to come down. Come down.
Yes, study of woman.
This one, sir.
How old?
Yes.
53-year-old woman. Yeah. This one, two persons have to read, one male voice, one female voice. Swati will give us the thing and Dr. Ashok will read after her so that we will understand the case in a better manner.
Next slide, sir.
You read this slide button. This one slide.
Yeah.
This
Mrs. W, I will read it. I will read it. Mrs. W, a 53-year-old woman.
Sir, slowly. Sir, slowly.
Okay. Mrs. W, a 53-year-old woman, has had gastrointestinal acid-related disorder, that is GORD, diagnosed by endoscopy. Mrs. W has a history of asthma, hypertension, and duodenal ulcer. Her current drug therapy include amlodipine 10 milligram in the morning, salbutamol inhaler 2 puffs as required, beclomethasone inhaler 200 microgram twice daily, and theophylline 300 milligram twice daily. Mrs. W has recently undergone successful hyperpylori eradication, that is Helicobacter pylori eradication therapy, which has been confirmed by carbon urea breath test. Mrs. W smokes 10 cigarettes a day, has a body mass index of 35, and does not drink alcohol. That's it, sir.
Thank you, Dr. Ashwath. I want one more female voice to read this.
Okay, sir. Mrs. W, a 53-year-old woman, had gastrointestinal acid-related disorder diagnosed by endoscopy. Mrs. W has a history of asthma, hypertension, and duodenal ulcer. Her current drugs include amlodipine, 10 mg morphine, salbutamol injection, baclomethazoline, 200 and theophylline 300 mg twice daily. Mrs. W has recently undergone successful Helicobacter pylori therapy, which has been confirmed by carbon urea breath test. Mrs. W smoked 10 cigarettes a day, has a body mass index of 35, and does not drink alcohol.
Thank you, Dr. Swati and Dr. Ashwath. I come to the next slide. So this is a case, and we say we care to do as per the pharmacy practice guidelines, interpretation, evaluation, and implementation. So we have to interpret the case. So while interpreting, we classify this case into three aspects: lifestyle factors, drug factors, and disease factors. So like this, you can have any other approach, but it is going to simplify how to give the pharmacy practice. So whenever we talk about patient counseling, we complain that the patients are not listening. They don't understand. So it is very easy to say. But again, from the patient point of view, if you look at why they are not listening, because whatever you say is from your bookish knowledge. And whatever you have learned in the college, you are going to speak to them. That they don't want. They want to do some experiments on them. So she is smoking 10 cigarettes, and she is also suffering from a burning sensation in the esophagus. Now you have got a good opportunity to tell the patient that if you, instead of 10 cigarettes, if you smoke 5 cigarettes, the burning sensation will come down. Can you do that experiment next week? So she will go and do that experiment, and she will find that the burning episodes have come down from 20 to 8. So like that, when she gets convinced that she will come and ask you, if I quit smoking, is it going to help me? So definitely you can tell them that this is going to help me. So this is how we have to do counseling. It is very skillful art. Very intelligently, we must understand the interpretation of the patient condition, and then we have to make a care plan and implement it. Coming to the drug factors. So I told you in the beginning, only doctors are not experts in medicinal chemistry, pharmaceutical chemistry, drug delivery systems, all these things. Even your director also told that they are not having no knowledge about this. So as a result of it, he has prescribed amlodipine. Amlodipine is a calcium channel blocker, and also it helps to relax the sphincter tone. Sphincter tone gets diminished and sphincter gets opened. Which sphincter? The esophagus and the stomach. Esophagus and stomach sphincter, if it opens, then acid will have a free bumping. So free, more burning sensation will be there. So why amlodipine was given? Can anybody tell me? Amlodipine was given to management of hypertension, isn't it? It's antihypertensive drug. So instead of amlodipine, the blood pressure can be brought down by many diuretics. So there are so many diuretics available. There are so many antihypertensive available. Amlodipine is not the only drug. Amlodipine is harmful to her because she is having GORD. So for GORD patients, amlodipine or any calcium channel should be avoided, and instead of it, they can give the diuretics. So if you cannot change the prescription because you can professionally you are supposed to interact with the doctor. So you can call a doctor and tell him that patient condition and whether he considers that is it safe to give the amlodipine again, which is going to affect her quality of life. The doctor will think again and he will change his prescription to diuretics. So this is how you have to win over the doctors. And talking about the theophylline, we all know that theophylline is a close relative of caffeine. How many doctors know the chemistry, medicinal chemistry, organic chemistry? They don't study, they don't know. So then this caffeine, which is very much akin, which is very similar to theophylline, is likely to cause irritation and cause more acid production. So as a result of it, the patient continues to suffer. So you can tell for asthma also there are so many drugs available, isn't it? In the asthma, in the treatment of asthma, there are plenty of drugs available. So those drugs can be prescribed instead of the uh, instead of the theophylline. So theophylline should be substituted, and this substitution you will give the registered pharmacist will give the clue to the doctor, and doctor will change, and your image and your respect and your positive thinking will make an impact on the physician's mind, nurse's mind. That's how we have to work in cooperation, not with the confrontation. So the next one is the disease factors. Many asthma patients who are having GORD is due to the acid through the esophagus entering the lungs and causing an acid stimulated asthma. So this is most commonly observed condition, and when the patient is there and the patient condition says that she is not having any infection of H. pylori. H. pylori infection is eradicated. Why? Because how they will do a test, diagnostic test, a gold standard test called as the carbon urea breath test. In the carbon urea breath test, they will ask the patient to take orally radio labeled urea, and this urea is metabolized into ammonia and carbon dioxide. Carbon dioxide gets there is a carbon dioxide level this thing, and it will be found in the breath. In case the patient has got H. pylori infection active, then only the urease is there. But humans, we don't make any urease enzyme, whereas this bacteria makes the enzyme. If the bacteria is eradicated, there is no urease, so there is no breakdown of carbon, breakdown of urea, and there is no detection of carbon urea breath test. So now you can measure the respiratory volumes with the help of a pee flow meter, handheld pee flow meter in your own pharmacy, and find out that what are the respiratory volumes. If the cutoff respiratory volumes indicate that the patient is not having asthma at this point of time, then you are doing a great service to the patient and to the pharmacy and to the doctors also. So you can tell the doctors that I have checked the respiratory volumes with the help of p-flowmeter in my pharmacy. She has good, healthy respiratory volumes. So we can think of the asthma medicines whether to be there or not. Doctor also will check and find out that there is
Excuse me, Dr. Nagappa.
no asthma.
Can I
Yes?
raise one question? Can I raise one question, Dr. Nagappa?
Yes, sir.
This is Professor CPS Verma from Laureate Institute. I would like to ask if the theophylline is making problem to the patient. Then can we go for the alpha agonist drugs?
No, this is the pharmacological experiment you are doing on a patient.
So,
We
okay.
should not.
Then
We should
what
not.
about
We should
the,
not. We should not. We should try to avoid drugs as far as possible. Please believe me
oh,
that no drugs can ensure the health to the people. Health is different.
it will be according to the
You have
age.
to keep away. You have to keep away the drugs from the patients as far as the way, because the same asthma can be managed with other drugs. This
Okay, okay.
point,
Thank you. Thank you.
pharmacist will be knowing about it.
Thank you, Dr. Anagappa. This I salute your very wide knowledge and salute for your this description.
Nagappa sir having the vast
How you
knowledge.
elaborated,
He is the
how you
ocean of
elaborated your
the knowledge.
balance between Sanskrita, sloks with Sanskrita, and in the community pharmacy. Really, it is very, very much excellent. Thank you, sir. Thank you very much. Because we have a short of time also, Dr. Mahadev Bhatt also waiting for this. Thank you, sir. Thank you so much. God bless you. Swati ma'am, can you invite the another speaker, please?
Just a moment. Just a moment. Another
Okay.
3 minutes I will take.
Yes, sir.
Okay, sir.
Yeah.
Right, sir.
So I think I'll come to the next slide, please.
Done, sir. So next slide.
Home medication review. This is very, very important. And there are some photographs are there. You can exhibit those photographs.
Next.
Come down. We used to visit the patient home and then we used to give the pharmacy practice to them. Yes. Come down. There are photos, not that. Still you come down. Still you come down. Go down, madam.
This one, sir.
No, this is photographs I'm telling you. There are 4 or 5 photos
Okay.
are there where we can see our students and
Upper slide, Dr. Swati, upper slide.
yeah. This is
This one.
a pharmacy student visiting the patient's home, monitoring the blood pressure. Monitoring, I'm telling you, not the measuring. Monitoring. Weekly, she used to go twice or thrice and find out what is the BP and what type of medicine she should eat and what type of how to manage blood pressure. She used to educate. Next slide, please. Next slide, please. They're all our students. 10 years ago. Okay. The home medication review, Dr. More important, which can be achieved by giving a pharmacy practice. Thank you very much. I close my session here. You can invite Dr. Bhatt.
Okay, sir.
Thank you, Dr. Nagappa. What a knowledge you have. You have vast knowledge. Really, I salute you. And the role of a pharmacist in the community, how best you have decorated your lecture. And you made the balance between Sanskrita and with the slow. Very much great, sir. Thank you very much.
I am grateful
Thank
to
you
you,
so
sir,
much.
for your kind gesture.
Thank you so much, sir. Now, our next speaker of today's event is Dr. Mahadev Bhatt. Sir has done all parts of pharmacy over last 50 years in USA. Sir had a work experience of 18 years in industry, drug, cosmetic, and nutraceutical in various positions such as R&D director, plant manager, operation manager, and sir has an experience of 12 years of hospital pharmacy as a director. For over 8 years, owned 4 community pharmacies with a home health care, injectable preparations, diabetic care, asthma care, osteoporosis center, breast cancer counseling, and geriatric pharmacy care. Sir has also been a part of Walgreens retail chain pharmacy. With this, I would like to invite Dr. Mahadev Bhatt sir to the virtual stage for delivering his talk on Community Connect.
Can you all hear me?
Yes, sir.
Okay. Dr. Verma, you had a question for Dr. Nagappa. I like to expand on that. Is Dr. Verma there or he is gone?
So, Verma sir is.
Okay.
He is there, sir. He is there.
Okay.
Dr. Verma?
Okay. Let me explain now. Okay. How
जी, नमस्कार
I'm,
Yes,
I'm going to
doctor, but
show,
I am here. Thank you. Please.
okay. I'm going to show you how does a clinical pharmacist will think about this. The example Dr. Nagappa gave, at there, the first sentence was amlodipine. The patient was a smoker. So she had some heart problems, then she had some theophylline. The whole issue was that amlodipine, being a calcium channel blocker, which picks up the voltage channel of L, it will expand the arteries to spread the blood pressure. So it acts on the smooth muscle. But whichever drug acts on the smooth muscle, they will act on all the smooth muscles of the body. Stomach splinter valve, that's a smooth muscle. So that will also get weaker. The lady is already a smoker. She is taking nicotine. She is taking this thing. So the acid from the stomach has gone up. So it is a asthma created by amlodipine. So that example was used by him to how to discontinue medication. Now, calcium channel blockers are not the first line of medication for the community pharmacy. If you have somebody in the emergency room, you can give them a shot of verapamil or something like that. That's a separate story. So the selection of a drug, that's where the pharmacist comes in. That when he sees the thing, he can modify it. In my opinion, that patient should have been given catapress patches because clonidine will reduce the dependency on smoking. Because clonidine is very similar to Wellbutrin, there is another drug, which reduces, people can live it. So this is what we need to project in community. Now, in a community pharmacy, and this is also a hospital-related problem, okay? I will, this morning around 3:13 or 3:14, I found out that today's topic is regarding hospital. So I made 2 phone calls, and they both assured me that if I talk a little bit about hospital, that will be okay. So I will try to tell you what did I do when I was in hospital, okay? I worked there for 12 years as a director, and I gave up my hospital in around 2001 or something like that, not 2001, around 1999 or something like that, okay? So this is a old story. But I will definitely talk about that. Now, Community Connect, you can put up my slides, okay? Go ahead and put up the slides. The Community Connect is a project where you can
Okay,
make
sir.
some money. You can make the money. In this country, there is no distinction between a diploma pharmacy, a degree pharmacy, or a PharmD. We all are capable of working either in hospital or in community. Okay? Now, what you learn as education is a separate issue. But to become a professional, you have to give a State Board of Pharmacy exam, which is a 6 hours examination, multiple choice questions and essay questions. After you pass that, you can communicate with the consumer. So the Community Connect is a program that how you can take the medication to the consumer. You can have a research and you can have a nice equipment and like chemistry, they will always need some analyzer and they need some machines, and you can make a formulation and everything. But till a person doesn't take the medication, how do you know it is working? We don't know that. So the more importance is given to the consumer. Why India has become a pharmacy hub of the world? Remember, people are playing with the words. You are exporting only the manufactured product if they are made right. Okay? But the other part of pharmacy, which we don't function in India, but the rest of the world is functioning. And that is what is the community connect. Why it is an entrepreneurial concept? Because we do not charge for our services in India. You go and buy a Cadbury, the same guy will give you the medication, and the same you go and buy Zithromax, the same person will hand you the Zithromax packet. Both the time he is not going to ask you that is this for your daughter, or is this for your son, or is this for your wife, or somebody's birthday, or when he gives the medication, he doesn't care that why he is taking it. But that is very important. And I'm going to give you one case study about blood pressure, and I will unite all the functions of a pharmacy can practice either in a hospital or in a community. I wrote down here wind blowing from the west to the east. There is a saying, hotel and motel. America is very famous for motels. 65% of the motels of America are owned by Patels. Okay? But in every town, if there is a one Patel motel, there are 3 Indian pharmacists, community pharmacists, because their children have become pharmacists, or the pharmacists have come from India. And we go, being an Indian, we like to be in a business. We like to be in a business where we can serve the community. A very simple example is that, you go to buy some fruits, and you want to buy some apple and banana. So you say, I want banana, I want apple. At that point, if that guy tells you that, sir, don't buy this apple today because they are not of your quality. You buy it next day. So what you will feel? Hey, he cares for me. He cares for me. That factor we have to put it in. And we do that factor here. I also work for Walgreens. I also work for Seven. Here they use that you be like an Indian community pharmacist. You do everything what they are doing and increase our business. The next slide, please. Now, do you love pharmacy or do you love your pay scale? Love of pharmacy is that you have got so much knowledge which you can give it to the people. But are you going to be an academician? Are you going to be a retailer who is just dishing out the drugs? Or you are going to tell someone how to take it? In a way, whosoever works in a drugstore, we are nothing but a drug pusher. We have got a license to push the drug. You go and register pharmacist, they tell you that you can touch the medications. But do you want to be that, or do you want to be more than that? I'm a little bit reluctant to say that medicines are dangerous. They are dangerous, that's why we studied them. If they were not dangerous, we wouldn't have become the pharmacist. So it is our expertise to handle that. And the way I look at it, now I am retired. Day before yesterday was my birthday. I'm 75 years old. I graduated in 1972. For 2 years, I went to Manipal. I was in the second batch of Manipal pharmacy. Then my grandfather expired, so I didn't have money. So I got transferred to Ahmedabad, LM College of Pharmacy, and I became graduate there. The way I look at it, medicine are like mother. Everybody needs medicine. At least I haven't seen a person who has not taken a medicine. You've got a headache, you go and take paracetamol, or you take a Dolo tablet, or you take a Zithromax. But if your mother gives you the medicine and they say, "Beta, tum ghar aa gaye, अच्छा है ना, आराम करो." You will feel a lot better. That's where the pharmacist comes to. Medicine may be dangerous, maybe needs something, but who is going to give that tender, loving care to take the medication? That's where we come from. That is a part of us. Now, if we are doing an extra service, you should get paid for it. If you do not want to do dishes, वो क्या बोलते हैं, बर्तन साफ करना है ना, तो आप बाहर से काम वाली बुलाते हो और वो साफ करती है. In America, we don't have that. When my children were getting married, most of the girls in India tell me that we don't want to come to America because we have to do all work by ourselves. अगर उसको पैसा मिल सकता है तो हमको क्यों नहीं मिलेगा? Other thing is that no one comes to pharmacy or hospital to say hello or how are you. Nobody. They are not there to come and propose you and give you a flower. So you're a nice girl, but you're a pharmacist, so I came now. They come because they are sick. Imagine when you are sick, you make everybody miserable in the house, right? You might go and tell your wife that this tea doesn't taste good. This vegetable doesn't taste good because you don't have a taste in your mouth. But if you love the business, then you can do anything in life. And that's what we are going to talk about. The next slide, please. It says 5R, The next slide, please.
Done, sir.
If you don't see it, that's fine. No problem. Try to bring it up. What I am going to say that I am not going to talk about this slide much because this morning I posted what are the definitions of BMR, HMR, MTM, QUM, ADE, TMR, and +1. So you all are supposed to read it. So when I come to the case study, if I say those things, you know what I am talking about. Okay? And if you have not opened that this morning slide, ask Dr. Swati. She has got whatever I could send her and she can give you the copy. The next slide, please. Data versus analysis. When I went to school, there were not that many Indian professors who had written the book. Dr. C.S. Shah has written the first cognitive book, and half of them was in the print. He used to tell us in the class that, but if you do not have books, how can you study? If you do not have library, how you can study? If you do not have data, how can you analyze it? If you do not make a data in your research work, then how can somebody else will go and duplicate it? How to progress into a community service is through BMR, HMR, TMR, and HCM. Look at the definition I have given, and you go from there. See, India is being an Indian, we are very lucky. We have got so many nutraceuticals in India, which can be used to avoid a lot of side effects. I will give you some example later on, after I finish the clinical study. And why do we need data? Because we would like what is the understanding of a patient about the therapy he is taking. That part is totally missing. Suppose somebody comes out of a heart surgery and he goes to rehab, then he goes to home. He still or she doesn't know that why he is taking all those drugs. So we are going to establish a link between a clinical staff, between a patient. The clinical staff could be a pharmacist and patient and a prescriber. The next slide, please. I could never understand one thing, that if a here doctors don't come home in USA, they don't. They will only come home when you are in a hospice care. I have also sent you the definition of a hospice care, like a terminally ill patient. The government pays for the services of doctors to visit those medication once in 3 weeks. Now in India, we can afford to call a doctor at home. The doctor comes, and most of the time they give you one injection, and they will give you some medication. But who is going to manage that medication? So why can't pharmacists go to the patient's home and look at all the drugs and look at all the over-the-counter products and tell them how to take it? And you can charge for it. Suppose you charge 500 rupees a family. You visit that family twice a month, okay? And you have got 20 families like that. What is your income? I was talking to Swati that doesn't she like to buy some extra sari or some bangles, make some $5,000 or $10,000 on the side. You are a doctor, you put a lot of years in the pharmacy, let's do something. Let me tell you here, to become a pharmacy graduate or a licensee, you must have a minimum of 2,000 hours of practical training, starting from the first year. A pharmacy professor will be working in a community pharmacy or a hospital, and a community pharmacist will be working on a hospital. Because we all want to make some extra money. That's why we came here to this country, and we get paid very handsomely. And every healthcare profession in this country has to work every other Saturday, Sunday. When I come to that example, I was working in 2015 or 16 on Thanksgiving Day. It was a Sunday afternoon, and that time that incident happened. Now, how do you will have a question, how would you approach to do this service, okay? So either you can target a medication or you can target a health condition. A lot of you professors may not agree with me, but just bear with me. I do not consider blood pressure as a disease. I do not consider diabetes as a disease, because those are the body conditions. Suppose there is no such thing as blood pressure, you and me won't be sitting here like this. Everybody has a blood pressure. Everybody has a sugar when you measure it. It can be high or low. So what does it mean? That we have not behaved nicely. It's something like that. We didn't listen to our mother. Like when you are married, you can never tell your wife that my mother makes better than you. Then she will say, you go back to your mother, That will be a simple answer. The same way, health conditions are there, but we need people to manage it. And I'm not going to say doctors are wrong, okay? Because I've got 2 children doctors, and in my family there are 17 doctors, okay? And most of the pharmacists who came here from India, most of our children are doctors. Because we knew that doctor makes more money than us, okay? So, to help the consumer, this is where you can start. The next slide, please. Okay.
Done, sir.
Everybody, please listen very quietly. I'm going to go through this very quickly. And this is a true incident. It did happen. And I was the pharmacist in charge. And I'm going to relate this thing with the overall picture what we can do. It was 2015, Thanksgiving Day, 3 days holiday. I was working that weekend, and I had a senior technician called Isha along with me. She was a Hispanic. I can understand Spanish, but I cannot speak Spanish that fluently. It's around 3:30 in the afternoon, and we measure everybody's blood pressure free. In any Walgreens they can go. We have got 9,000 stores, 2 people walking into the pharmacy. One lady is around 45 years old. One child is around 14 years old, and they are very agitated, red flushed cheek, And the younger girl said that, we want to measure the blood pressure. So I gave her the form to fill it out. She didn't like it. She made a face at me. So he says, no, my mom is sick. You have to measure the blood pressure. I said, that's right. I will do it. So I looked at Isha and I said, why don't you fill out this form and I will go and measure the blood pressure. She was only 14 years old. And I could have asked her to sit down and not to come in my way, when I'm doing business. But I didn't want to do that because the situation, I had to handle it very gently because there is a person who was sick and that was her mother. I went out and checked the blood pressure. It came 237 over 92. That's pretty high for the 45-year-old. Okay. So I looked at her. I tried to talk to her and I asked her, would you like to drink something? She says, yeah. I said, do you like coconut water? She says, yeah, I like coconut water. During this time, I'm looking at my pharmacy because I'm out of the pharmacy, okay, in another room. So Isha said that I should come in. Now, reason she said that because she wanted me to look at certain things, and this is where the data collection comes to prevalence. So I went in the pharmacy and I told her, why don't you talk to this girl in Spanish and find out what happened over the weekend? Because generally, whenever there is a long weekend, all the families get together, everybody talks to each other very loudly, and eventually, by the second or third day, they will have some kind of a misunderstanding. There is always a fight. We call a cousin rivalry. My children are better than your children's, and I bought this thing and I bought that thing. So I wanted to find out what was going on. I went inside the pharmacy and Isha had located that patient, that she was our patient since last almost 3 years. Her current medications were birth control pill and a blood pressure medication called metoprolol tartrate 50 milligrams, one tablet twice a day. Okay, the patient had taken, in past had some recurrent UTI and yeast infection. The patient had also taken Plan B. I don't know what you call in India, but it's the emergency contraceptive medication. She had taken only once, but she was late in picking up. But she was not out of the window. She was a little bit late. Generally people come next day morning, but she came one day after. So I had sold her that and I said that, it's okay to take it and so forth and so on. So what they tell me, that patient has got a medication adherence problem. She's a little bit lethargic. Okay. So I told Isha, I said, you wanted to drink some water, why don't you go and buy some coconut water and give it to her and let her drink 16 ounces of coconut water and I will be out there. At that point, Isha had already informed the store manager that, Dev has got a difficult case, so we might need some extra help in the pharmacy. And nobody else can come in the pharmacy. They have to be licensed by the State Board of Pharmacy, as a technician. All the store managers who work for Walgreens, they are technicians. They have to clear that as well. Next slide, please.
Done, sir.
So now she finished the coconut water, and while I was coming back to measure her blood pressure again, and Isha was going in the pharmacy, she told me that they had some kind of a misunderstanding in the family. So there were some, difference of opinions. And since she had a lot of visitors at home, she had not taken that metoprolol tartrate last 3 doses. And all the teachers, you should know metoprolol tartrate is a beta blocker, right? So there is going to be some kind of rebound blood pressure effect. So I had my answer that no, I can handle this case. Okay. So I came out and I told her, I said, how do you feel? The girl is smiling now. The redness has gone down after she talked to Isha. And I said, would you like to go and void your bladder? He says, yeah, I prefer that. I said, do me a favor. Before you do that, finish your coconut water. You breathe in through the right nostril, then close the nostril and take the breath out through the left nostril. And do that 10 times and then go to bathroom. It's a simple neti deti, this pranayama yoga, which can help the blood pressure. And being an Indian, everybody should know that. She did that. She went to the bathroom. She came back. She looked very relaxed. I was surprised. She was not even shaking. She walked alone. Her daughter didn't have to take her to the bathroom and come back because when she came, her daughter was holding her hand. I measured the blood pressure again. The whole thing happened within 15 minutes. Okay? I checked the BP, it came down to 157 over 82. So at this point, I knew that she has not taken last 3 doses of medication. So I told Isha, pull out a 1 tablet of metoprolol tartrate, 50 milligram. It's around 3:30 or 4 in the afternoon. Give her right now in front of me and tell that patient that she has some tablets sitting at home because she has not taken regularly, but she should take the next tablet at night. And then she can go home. Next slide. Next slide, please.
Done, sir.
Okay, that's fine. Now, here I have tried to unite 3 or 4 things. Data collection, how to talk to a patient. Patient can be unreasonable and you have to be reasonable. You have to find out what is their condition and how you can take them out. Now, what actually, now let me say that a little bit later. Now, I need to finish one more job there. I had to let the doctor know who had prescribed that medication. That doctor name was Dr. Leon. So I came to the pharmacy and I wrote down, dear Dr. Leon, such and such thing happens at such and such time. And you always write times in military hours, 15:30, so it doesn't have to be AM or PM because they know those are known as a military time. The time it was afternoon or it was early morning, And this patient, I like to recommend that she will respond to metoprolol succinate 100 milligram extended release once daily tablet to avoid any drug adherence problem. If you like to do that, please call the pharmacy and we will change the prescription. That prescription is available in generic, so the insurance copay doesn't change. This is where my responsibility got over. I made a note of it because Monday I was not working, some is going to come. So if the doctor comes back, then they know it. But what is the most important thing I did here? I intervened to avoid an unnecessary emergency room admission to save the healthcare cost. If that patient normally, if pharmacy would have not treated them the way I treated them, they would have ended up in a hospital. The cost of hospital is first to call the ambulance. That is $200. To go and fill out the form at the hospital, $150. They put you in a wheelchair, that is another $200. If they give you a bed, because first they do a triage, you need to be in or not, okay? Once they put you in a bed, they have to put you all the IV plugs. Because suppose you croak at that time, what are they going to do? So the bill jumps to $5,000 because now the nurse, the LVN, the central supply system, the laboratory has come and do it, and eventually what they are going to find out, oh, she forgot to take the medication, but keep her overnight for observation, and next day we can let her go. So this is what a good pharmacist can do. You can change this slide, but I'm going to add one more thing. Go ahead, change this slide, social pharmacy responsibilities. Now, these are other examples, where people should know. what is going on. Birth control pill and antibiotics. I have got a big story about that. Maybe sometime in future we'll talk about it. Birth control pill and antibiotic tablets are a prescription for pregnancy because the effectiveness of the contraceptive goes down by 17%. When you use condom, it is already 90%. Still people get children. No wonder the Indian population has gone to 1.4 billion now. You know, how many times this thing happened? Suppose it is a woman's choice. Birth control pills are not to prevent the pregnancy, but they are there to have their period regularly, every 3 weeks or every 4 weeks. If a family was going to take a vacation, they picked up the birth control pill, and then the woman had a toothache, and the doctor gave her amoxicillin 4 times a day, and he said, "Yeah, you take for 10 days. When you come back from vacation, you do it." She uses at the same time. By the time she comes back, she is pregnant. What we say, oh, भगवान ने दिया, भगवान ने दिया, वो pharmacy ने दिया. भगवान ने कुछ नहीं दिया. Pharmacist forgot to tell you that you should do that. You know. If I ask a question, what is the most overprescribed medication of the world? Can somebody answer me? If you don't, I will answer it, okay? Just scratch your brain for a second. The most overprescribed medication in the world. Simvastatin. Simvastatin, that, hyperlipidemia tablets is the most overprescribed medication in the world. Now, you know what happens? Anybody who takes any kind of a simvastatin, by the end of the 6 months, that's for 100%, or between 3 and 6 months, they will have a leg cramp, and the pain starts from the calf muscles. They feel tired, you know. But people don't talk to each other. If they talk to doctor, they will say, "Oh yeah, अच्छा हो जाएगा." You know, ठीक है, वो तो सबको होता है. You know why this thing happened? We studied this in second BPharm. I studied in second BPharm. Now, I am a graduate from 1972. Syllabus was only 6 pages. Look at your syllabus, at least 40 pages. You guys are smarter than me, you know, because you study more. But I knew in second BPharm that when you study your biochemistry, remember that Krebs cycle, remember that ADP, ATP conversion to get the final energy. And there, if you check it, there was a coenzyme Q10, which helps to convert to the final energy level. Simvastatin kills coenzyme Q10. So the muscles doesn't get enough oxygen. So they feel tense, and we call it tired. In homeopathy, they call it a restless leg. Restless leg means what? It's a cramping, but you need some. It has nothing to do with the rest, but the muscles are not getting enough oxygen. Now, how can you correct this? In India, it is available. Coenzyme Q10. It is available. 200 milligram or 300 milligram once daily. It will help you. Magnesium supplement is the most forgotten ingredient in the world. Everybody will talk about calcium, they will talk about potassium, but when you are talking about calcium channel blockers and the potassium channel, have you ever thought that magnesium is competing with them, and somewhere magnesium is getting lowered, so the ventricular contraction is not taking place properly? At Kaiser Foundation, anybody who is given simvastatin, a medical doctor will write a prescription for coenzyme Q10 and a magnesium supplement, and the best supplement magnesium is magnesium chloride. Now, pharmacists may not fill those medication. You can buy them at Costco, but if you carry them in your pharmacy, you are going to make extra sale. And I was told that final BPharm or final BPharm students have about 50 hours of nutraceuticals, you know. So this is part of the things we can study. Anybody who takes antibiotic, they need some probiotic. We have to be very, very careful about steroid after the pandemic. Steroid causes diabetes, the blood sugar goes skyrocketing. But sometimes
Excuse me, Dr. Mahadev Bhatt sir. Excuse me,
uh-huh,
Bhatt sir. Can I ask one question?
sure.
Yes, is it a malpracticing of the doctors to use statins? Is it really affect the lower the lipids and all, or
No, no,
aspirin
no.
is the best?
It is not a malpractice. It is okay to use the statins, but you have to use it. In the old days, it used to be 80 milligram. Now it is 20 milligram. Then you go to 40. But you have to monitor the patient, and as soon as you see the side effects, like leg cramps, then you make it earlier. Okay?
The mitochondria is giving extra energy to the vital organs like lungs, kidney,
Yeah.
heart, and
So that's what I
other
said.
vital
So
organs.
these are different. Yeah,
Q10
I
enzyme
know
will give extra energy to vital organs, and
that.
this Q10 enzyme is available in the Arjun bark.
I
Arjun
understand
bark,
that.
yes.
Yeah, I understand that. I'm coming to that because I cannot finish everything. Uh, you're right. You're exactly right. That is the advantage they have got. But are we doing it at a pharmacy level? I'm trying to show that there are so many things you can do as your extra service to make the comfort of your patient and charge money for that. I gave you an example of 500 rupees a month for one family. You go and check it. And who wouldn't like it? I get a WhatsApp message from Kaiser Foundation because I'm diabetic. Did I walk in the morning or not? And what is my walking time? One time I wrote 30 minutes. They says, no, sir, you are supposed to walk at least 3 hours a week. I wrote 30 minutes. I thought it is only for a day, you know. And he says, after walk, do you feel? Can we tell you every day, what time we are going in, what time we are coming back? Those are the free services. People can do it with a WhatsApp. Even the hospitals are doing that. Every time you give a blood pressure medication to anybody, it is our duty to ask them that, are you taking this medication for the first time? If you are taking any blood pressure medication for the first time, you are sure going to have hypotension. You should sit down for 10 minutes, drink a glass of water before you take the medication, and drink another half glass after you drink the medication, and sit for 10 minutes. And like suppose we call patients, those who are taking the blood medication for the first time, we make them a phone call at home and ask them, how are you doing with your medication? Do you feel good? Or do you want us to tell us something? We can let your doctor know. Imagine that somebody will ask you about your health, how good you will feel. You know, if suppose you ask to your mother, your grandma, that, hey, did you take your medication at this time? Did you do this thing at this time? We have to go into those kind of services, and if we can start at the school level. See, I am not a good teacher. I am a professional. You all are teachers. You have made so many PhD students who have done so many much research. So India became the pharmacy hub. But will you please help us to create a generation of pharmacists who care for the patients, who will make sure that the medication you have invented is being used rightly? You know, suppose somebody take a steroid and he is already having a high blood pressure. I'm sorry, high blood sugar. It's going to shoot up. 50 milligram of prednisone will shoot up the blood pressure in 3 days to 800. So we have to manage it. We have to tell the patient what to do. But sometimes you have to give a steroids to a patient who is having a diabetes. The next slide, please.
Done, sir.
Nutraceuticals. I don't have to tell you all because government of India gave a Padma Shri award to Dr. Khader Wali, who is known as the Millet Man of India in 2023. Is the International Millet Year. Every Walgreen and a CVS pharmacy are selling millets. They cure a lot of body conditions. I eat millets too. Dr. Nagappa gave an example by putting mung beans. The whole thing is about the ratio of carbohydrate to fiber. I sent one of the chart to Swati about the millets, and the Sri Dhanya millets are the nutraceuticals. And any millet which has got a carbohydrate to fiber ratio 10 will surely go into the body in 2.5 hours. I will give a very simple example to all the teachers. When you eat rice 100 grams, it gets converted into 75 grams of carbohydrate. That 75 grams of carbohydrates get converted into 30 grams of glucose. On the average, human has got 5 to 7 liters of blood. 1 liter of blood has a 5-gram glucose carrying capacity. Now, by eating 100 grams of carbohydrate, if your blood is already saturated, with 30 grams of sugar, so you are going, and then how much we are abusing our body. Now, if you eat 100 grams of millet, it's going to take 2.5 hours. This happens with rice, it happens in 30 minutes. So there is a midway somewhere, and why we need the protein in the diet. And how often a person goes to a hospital, how often a person goes to a doctor, and how often a person goes to a pharmacy. But the pharmacy, they go maximum time. But we cannot change the retail pharmacy they are practicing. They are going to keep dishing it out. So to make money, we have to go into the other way and try to meet the patient when they are discharged from the hospital or from the hospital to the ambulatory care, to the community care, and we manage them. And we give the information back to the doctor. Like the way I gave the information about the incidents happening in my pharmacy, your doctor will appreciate. That patient, the week I treated her, next day on Monday, I was not working, but she bought a big cake for 15 people for the pharmacy because she was so happy. After 2 days, Dr. Leon stopped by the pharmacy and told that that I received your email and thank you for treating my patient. And he brought a prescription for the patient in our window. We have got a drive-through window and gave it to us that stop the old medication and do this thing. So there are a lot of opportunities. In next 3 minutes, I will talk a little bit about hospital pharmacy. I promised to Dr. Singh and Dr. Swati. In hospital pharmacy, the most important function of a pharmacist, in my opinion, is to check the crash card. There are several crash cards on different stores. There is a crash cart in OR, there is a crash cart in cath lab, there is a crash cart on every nurse's station. The medication you put in, you should have a tag outside that what is the earliest medication expiring, because in emergency they open a crash cart, and suppose they find a medication expired, then the pharmacy is reliable. Other thing is that you have to be careful is most of the insulin, because see, I have never worked in India, so I don't know how they practice there. Okay, I'm telling you from my experience here. I came here when I was very, very young. I came here in 72. Three months after I passed the exam. Okay, and any multiple vial like insulin, the nurses will measure it and they will give it to the patient. You have to put a date on that because any multi-dose vial, they are not good after 30 days, even though it says that it will expire after 3 years. Same thing you should tell the patient. You gave her a 10 ml vial, he is taking only 5 units a day, and so it's already punctured. They puncture 30 times, it is gone. You cannot assure it. Other thing is that clinical pharmacists are required because you have got gentamicin, you have got Venco. Yeah, before I forget, let me talk about Genta. Okay, he mentioned about Genta. How do you give the gentamicin? Are you giving it IM or you are going to give it in IV. But if you are, in my opinion, you should give IV. I did a research on gentamicin once a day, single dose. So I don't get this ototoxicity. Okay, and I gave 1 milligram per kg body weight, and then I was okay. But I gave it to the patient those who had a large volume of IV going at the same time. The ototoxicity will only happen if there are not enough fluids in the body. If you take a cancer patient, she doesn't have enough fluid. So it is out of that hospital. It should not be there for them because they are all dehydrated. Gentamicin, gram-negative organisms, it works great. I use them for my labor and delivery. They all are hefty women. Everybody puts on the weight, right? And when the delivery is happening, do you know how much water they pump into them and how much magnesium they give them? They can kill a dog. The dogs are killed by giving extra magnesium so they don't get that placenta tied up, And to that woman, to have a discharge in 3 days, I gave them gentamicin single daily dose, and I didn't have a single incidence of ototoxicity. So what you are putting in, you have to look about it. Other things the pharmacist can take care of is from which arm they are taking the lab test. I think I talked to Swati a little bit. Suppose you are doing vancomycin, so you have got aminoglycoside. So or you want to do a potassium test, and the potassium is running at 100 ml per hour, and you want to check the potassium level. The lab technician doesn't know which side they should take it. If it is potassium is going to the left side, you don't touch the left hand. You are going to get a higher potassium value. You go on the right side when they finish the whole cycle. Same thing if you are going to give a vancomycin, which has got a trough and which has got a peak. So when you give the first dose, you want to do the peak, or do you want to do the trough and the third dose? Then what time do you adjust it? Is it at the end of the cycle or it is just before the cycle? Lab technician doesn't know that. So when, I don't know, in India they write orders in the hospital, because here we write on the chart, and we tell them precise timing that this is the time you should do it. But there is another thing here.
I just want to remind you, just 2 minutes are left.
Okay, I'm almost done. As I promised you, I was talking about hospital, Other thing is that your therapy should be time bound. You started an antibiotic in a hospital. If it doesn't work for 5 days, that antibiotic is no good. You have to have a blood culture test right away, and you should inform the doctor. You should be in touch with that. And it is very important to do the antibiotic review. You cannot do too much counseling in the hospital. But if a pharmacist can talk to the discharge nurse and find out which patient is going home, then you have got an idea how to change the IV antibiotics to the oral antibiotics. There is a theory behind it. Are you giving cephalosporin or have you given Rocephin, which kills everything? And if patient has got that, how are they going to go home? You have to check the in and out of the patient. That how much fluid is going in and how much fluid is come out. And you check the ratio, because sometimes patients will just keep picking up the weight. And these are all the responsibilities of the pharmacist. I'm done. There were some hands up,
Okay, thank you, sir. Anyone wants to ask any question? Okay, so I would like to invite CPS Verma sir for vote of thanks.
Yes, Swati madam, thank you. I would like to take this opportunity on record to place my vote of thanks to the great pharmacist, rather clinical pharmacist, who's giving a vast and wide knowledge to all of us. And other than the hospital, what is the role of a pharmacist, clinical pharmacist? Dr. Mahadev sir, he expressed so nicely, and I would like to thanks to Dr. Nagappa sir. Dr. Nagappa sir, his expertise and a vast knowledge, I must salute him, and I pay my gratitude and respect to both the speakers. Thank you, sir. Thank you, both of you. So nice of you. I would like to extend my vote of thanks to our Managing Director, Professor Dr. Ransing sir. I pay my gratitude and regards to him. Thank you, sir. I would like to pay my regards and gratitude to Professor Dr. M.S. Asaf sir, who arranged such a nice webinar, international webinar on the role of a pharmacist, clinical pharmacist in the hospital. And I would like to extend my vote of thanks to Dr. Pushpinder. Dr. Pushpinder is a expert or MD. He did MD in community medicine. Thank you, sir. I would like to pay my thanks to Shri Gopal Sharma ji, President, Himachal Pradesh Pharmacy Council. Thank you very much. I would like to extend my vote of thanks to Professor Dr. Vinay Pandit, pharmacy professional, worthy pharmacy professional. Thank you, sir. And at last but not least, I would like to pay my thanks to all the participants, HODs, professors, associate professor, assistant professors of Laureate Institute of Pharmacy. And after that, I would like to extend my vote of thanks to all the participants present and who attended this international webinar. Thank you very much. Over to Swati.
I like to add one thing.
Yes, sir.
You forgot one name, Dr. Swati Rana.
Yes,
Thank
Dr.
you.
Swati Rana for moderating this webinar. Thanks so nicely, Dr. Swati. Thank you also. Thank you very much.
And who is right now into teaching his her husband how to cook, so good luck with that.
And I forgot one thing, Dr. Mahadev, but I would like to congratulate you for your happy birthday. I would like to wish you happy birthday. You have 75th years. Thank you, sir. And Dr. Nagappa, senior people, and they have vast knowledge. Really, I would like to salute you and your expertise. So nice of you. Thank you, sir. Thank you very much.
Yeah, please help us to spread the word around, and let's make a new generation of pharmacists who can make more money. To make 1 lakh rupees a month is not a joke. It's very easy. You need 100 patients, 500 rupees. And we have studied so much. Why give it away for free? People can afford that money. Please do that. Thank you. Namaskaram.
Thank you so much.
Ananda, thank you so much. Swatiben, thank you. Goodbye.
Okay.
Bye, Ananda.